This report discusses the choice of the optimal number of factors to predict the severity of bronchial asthma in children in linear regression models. Bronchial asthma holds a specific place among allergic diseases. Currently, due to the rapid increase of asthma incidence, this pathology can be considered as a global medical problem. The tactics of treatment and observation of patients have been developed to increase the level of disease control, based on the use of stepwise therapy. However, there is a fairly large category of patients who are characterized by an uncontrolled or severe cause of the disease, which confirms the presence of different pathogenetic mechanisms of the onset of bronchial asthma. Studying not only the factors, but also determining their relationship with each other, is an important step in understanding the cause of the disease in each individual case. Regression models are used for preliminary assessment of the severity of bronchial asthma. Despite similar symptoms of bronchial asthma among patients, the result of treatment and further prognosis of the disease is very different. Investigations have confirmed the presence of various phenotypes of the disease and the influence of a huge number of factors on the occurrence of bronchial asthma and the peculiarities of its cause. In this regard, the issue of choosing factors to obtain satisfactory accuracy and what types of models should be used is relevant. The use of a limited number of studies is determined by the methodology and the standard set of reagents. To demonstrate the methodology for constructing approximate models regression, we will use the results of a clinical study of the severity of bronchial asthma in children of the Kharkiv region in 2017. The asthma severity analysis group included 90 children aged 6 to 18 years. The structure of the group was as follows. The main subgroup included 70 children with bronchial asthma. The control group, 20 healthy children. Analyze the data of a survey of parents about symptoms in patients, characteristic of bronchial asthma, as well as the history of the disease of the patients. This information served as the basis for the values of the qualitative factors used to build the regression model. The clinical features of the cause of the disease have been studied. Based on the results of laboratory studies, the values of the quantitative factors of the model were formed. During the analysis, 142 factors were considered. The regression model for determining the severity of bronchial asthma disease can be presented in general terms. To construct regression models in accordance with criteria, the most significant factors were selected that determine the severity of the bronchial disease, the numerical characteristics of which are presented in the table. The first step of the study after choosing the factors is to build a set of linear regression models for predicting the severity of bronchial asthma disease and comparing the quality of the prediction of the observed value for a different number of model regressions. As a criterion for comparing models, we will use the MSE value. 1, 2, 3, 5, 7, and 10 factorial linear regression models are considered. 11 factors were used to build regression models. As a result of selection from a variety of models with the number of regressors equal to 10, 7, 5, 3, 2, and 1, the model with the highest and lowest MCA values was selected. The results of the choice of models are presented in the table. When building linear regression models, outliers were removed from the original dataset. The MSE dependencies presented on the graphs for models with the best and worst forecast quality allow us to estimate the influence of the number of regressors on the approximation accuracy. The dotted line in the graphs shows the average MSE for a given number of model regressors. The range of valid values for a set of models is limited by the upper and lower curves. The graph clearly demonstrates the general trend of decrease in MSE with an increase in the number of model regressors. The comparative analysis of values for multivariate linear regression models used in the example of the considered dataset shows that the use of models with less than 6 factors is inappropriate. The results obtained indicate their linear regression models with a small number of factors have approximately the same value. As a result of performing of this study, an important conclusion was obtained that the value slowly decreases with an increase in the number of model regresses. This raises the relevance of the search for new methods for predicting the severity of bronchial asthma disease, including the use of machine learning. A prospect for further research is to analyze the quality of fit the observed value depending on the number of regresses for different types of non-linear regression models. Thank you for attention.